We should be streaming live, hopefully, on Facebook and via Zoom. If you're on Facebook, you can leave some comments in the comments box. Yeah, you can leave some comments in the comment just underneath this feed. If you've got any questions at all as we go through this session, then feel free to pop some questions in there. And also, if you signed up via Zoom as well, then you can pop some questions in the chat. This will be available on our Facebook page afterwards. So Movement Therapy Education. You can watch this back. You can watch the live stream back. Obviously, you won't be able to ask questions then, but you'll be able to get the content. So I'm imagining this will be around about half an hour. So it's a really brief, quick introduction to the use of an AED. And use of an AED in particular, and basic CPR. It's aimed really at anybody. So if you've done some work before with CPR, you've done some first aid courses before, then hopefully it will be a refresher for you. If you haven't done any of those things before, then hopefully it will give you enough confidence to just give it a go. Okay, so that's the main thing. I've popped this up here just on the left hand side of me. This is lifted from the British Heart Foundation website. And if you go onto there, there's some really useful resources to do with AED, how they work, and lots of information about their use. And there's also some free resources, of which this is one of those. So this poster basically says anyone can use it. So no training is necessary for you to use an AED. So if you were worried about hurting someone, harming someone by using it, it's absolutely impossible to do that. The way the machine works, which we'll go through as we go through this introduction, you can't physically do any damage to someone who has no problems. Okay, the machine won't work if your heart is beating in a normal rhythm. So you're completely safe to use this, okay, and that's really important. This is so an AED can be used for an unconscious person who is not breathing normally, and that might seem like a weird thing to say, what is normal breathing, and we're going to go over that as we go through this session as well. This little bit here at the bottom is the chain of survival. So we've got call 999, so that's your main priority. Make sure an ambulance is on the way, and then starting CPR, which we'll go through in a second. Get the defib on and then follow the instructions. Okay, that is an element of the chain of survival, which we're going to have a look at in a second. The key, if you have a defib near, is not to delay putting it on your patient or your casualty. Okay, so that's really important. So just wanted to share that right at the beginning, and I'll leave that up for the duration of the session. So just an introduction to me. My name is Mike Grice. I'm the Director of Movement Therapy Education, and I was thinking back the other day about how long I have been doing defib training. It's 20 years this year, actually. So I was really lucky. I was part of one of the first health club chains in the country that had like the foresight really to get AEDs into their leisure centres. I was trained really early on, and it was at that time, because I was an operations manager of a health club, I started getting involved in the training of our lifeguards as well. I've probably trained thousands of lifeguards, thousands of first aiders over the last 20 years. And the use of the AED has made a massive difference to people's confidence in being able to administer that immediate first aid. And I've been meaning to do something like this for a while. It's knowledge that I've got in my head, and there's loads of stuff available on the internet as well. So just want to point you in the right direction really, and give you a little bit of confidence, like I say, to use this really vital piece of equipment. Cool. Okay, so I'm just going to switch on to my PowerPoint a second. There we go. Okay, cool. So like I said, this is just going to be a bit of an introduction to CPR and AED. So CPR is cardiopulmonary resuscitation. So cardio to do with the heart, pulmonary to do with the lungs, and then resuscitation is obviously resuscitating those vital organs and keeping them fresh with oxygenated blood, basically. That's what we're trying to do when we do CPR. And then AED is an automated external defibrillator. And the key word there is automated. So for a lay person, you will not have to make any decisions. You won't have to worry about any major buttons to press apart from one or maybe two buttons, and that is it. So it's a really simple piece of kit to use. Obviously, we've just gone through that, like I said, that's from the British Heart Foundation there. So if you visit their website, what they'll also have is a list of venues where they have defibs that are local to you. I have a defib in my clinic, and we, touch wood, we've never had to use it, but we've registered it with the British Heart Foundation. So if there is anybody who has a cardiac arrest near us, then somebody can come and get my defib. Okay, that they can come into the clinic, say they've got an emergency, and then we'll go and help them out. So there may be places around you that offer that same kind of service. Okay, so if it's a local football club or a leisure centre, or usually railway stations, bus stations, those kind of places usually have defibs fairly close to you. So it's worth looking in your local area to see where the nearest one to you is. So first thing we're going to have a look at is cardiac arrest. And this is what happened to Christian Eriksen on the weekend. And again, this is teaching from scratch. So just going to show you a little video about what a cardiac arrest is. So let me just bring this up here. Okay, so Steph's just said, I think there's an app that shows where there are first aiders. Great. Yeah, if you could let us know that app, that'd be brilliant, and we can share it amongst the group. That'll be fantastic. Okay, so this is a little video again from the British Heart Foundation about what a cardiac arrest is. So I'm just going to play this, and then we'll discuss the next bit.
Your heart has an electrical system that regulates your heartbeat and keeps blood pumping around your body. A cardiac arrest happens when a problem in this electrical system causes your heart to stop pumping blood. It's commonly caused by a heart attack or an inherited heart condition. Max wasn't aware that he had an inherited heart condition until he had a cardiac arrest while at work. The electrical circuit in Max's heart stopped working as it should. Instead of beating regularly and effectively pumping blood around his body, Max's heart quivered, stopping blood flow and causing him to collapse.
Okay, so I'm just going to pause that there, just break down this video a second. So if I just scroll back a couple of slides there. So we've got some key parts of the heart here. So these are the receiving chambers of the heart called the atria, and then these are the pumping chambers of the heart called the ventricles. There are a couple of key, what we call nodes around these areas. So we've got the sinoatrial node at the top there, and then there's an atrioventricular node between the atrium and the ventricles. So what will happen is a signal will come from the brain, and this is all part of your automatic nervous system, autonomic nervous system, and it will send an impulse into the SA node, which will then contract the atria, and then those atria will then squeeze the blood down into the ventricles. That message will then get sent into the ventricle chambers, and then the ventricles will pump, and then that blood will go either to the lungs or around the body. Okay, that's where we get that lub-dub type sound of a heartbeat. So if you ever listen to a heartbeat on a stethoscope, it's duk-duk, and that's the atrium ventricles pumping. And they have to pump in a certain rhythm so that you eject the blood into the ventricles, and then the ventricles pump it out around the heart. So the cardiac arrest issue is around the electrical signals. For some reason, and sometimes it's investigated and they're not really sure, there can be many different reasons why that electrical signal is interrupted. What will happen then is it doesn't then beat on a normal beat, and it starts to quiver, which was the part of the video that you just saw. And that quivering is called fibrillation. Okay, so that when the ventricles fibrillate, it's ventricular fibrillation.
Max's heart stopped working as it should. Instead of beating regularly and effectively pumping blood around his body, Max's heart quivered, stopping blood flow and causing him to collapse. This life-threatening heart rhythm is called ventricular fibrillation, or VF for short. Max will have no memory of collapsing, as the lack of blood and oxygen to his brain caused his brain cells to die, creating temporary memory loss. Max was unconscious, unresponsive and not breathing properly. His colleague quickly called 999 and another began CPR.
So we'll just stop that there. So that's the kind of first bits of understanding why people collapse suddenly like that player on Saturday. Something has gone wrong with the electrical wiring in the heart. So then the heart starts to quiver instead of beating on a normal beat. And because of that quivering, you're not then able to get blood around the body, but especially to the brain. And you have around about 3 minutes without oxygenated blood before the brain starts to die. You need to act really quickly. That's why immediately, if you have a defib there, then you get a defib on really quick. And obviously in professional football, they will have defibs on the side of the pitch, as they did on Saturday. They will do cardiac massage or CPR immediately as soon as they found out that person's not breathing properly. And then as soon as they'll get that defib on. So it's all to do with speed. You've got to be really quick. So that was a little bit about cardiac arrest. Yeah, this is another picture about basically what happens. So that sinoatrial node at the top there, that will initially contract so squeezing blood into the ventricles, which are these chambers here. And then you've got another little node there, the AV node, the atrioventricular, so between the atrium and the ventricles, that node there. And then we've got some bundles of nerve fibers that run down the center of the heart and then innervate or switch on the ventricle muscles. The signal then passes down there. That then stimulates the contraction of the ventricles, and then that forces blood out either pulmonary artery or the aorta. So pulmonary artery will go towards the lungs, and the aorta will go to the rest of the body. Okay, that is the electrical signals that aren't working properly. Okay, so that's what's key with the cardiac arrest. Different to a heart attack, where a heart attack is to do with the blockages of the coronary arteries, which are the arteries that supply blood to the heart. Okay, so this is an electrical wiring problem. A heart attack can cause this, but they're two different things. So if you wonder what the difference is between the two, then that's the main differences. So this is the chain of survival, and this is where we fit in. So let me just pop this up on here. So thank you for that. So Steph has just let us know the name of that app. I'll just put it on here if I can and make sure I spell it. There we go. So the app is called Good Sam. I'm imagining that's to do with Good Samaritan. So if you search for that app, then it will give you a list of first aiders as well. So that's really good. I didn't know about that, so I'll be registering myself onto there. So thank you, Steph, for that. That's brilliant. So yeah, so early recognition and call for help is really key in preventing a cardiac arrest. And as you saw on Saturday, sometimes it's not preventable. Okay, and sometimes it will just happen no matter the early recognition signs. Then immediately you want to start CPR. Okay, so CPR is only to buy time. The percentages of people that survive from just doing CPR alone are really low. There's something like 2 or 3%. So if you had no defib, no emergency help, and you did CPR, then the chances of that person coming back again are really low. They are massively improved when you have a defib. And we'll talk through the numbers of that as we go through. So early defibrillation is really key. And then obviously because you've called the emergency services here, then we've got the post-resuscitation care, which is the emergency services. And they're the next stage in the chain of survival. So if we don't know how to do that, and you don't have one of those, and you're just waiting for an ambulance and usually 8 minutes response time for a category A, then that person's in trouble. Yeah, we're at the very least, really, we need to be doing CPR. And then obviously if you have a defib, then you can get that on them as quickly as possible. So that's the chain of survival. But what do you do when you approach a casualty? On my courses, I teach it Dr. Saab, and different people teach it in different ways. But the first thing you do is obviously check for danger to yourself, because if you haven't seen what's happened, then you don't know why they're unconscious. You check for a response, and the way that you do that is if we just flick onto the next slide, you check to see if they're alert. So you can say, hello, can you hear me? Can you open your eyes? And see if you can get some kind of response from the casualty just by giving them simple commands. If they don't respond to your voice, they may respond to pain. So you can hold onto their earlobe and you can twist their earlobe, look at their eyes, look at their face to see if they respond to that pain stimulus and to see whether they're unconscious or not. If they don't respond to the pain stimulus, they are unresponsive, unconscious. Okay, so if we just step back a step, so that is the response checks: voice, pain, and if they don't respond to pain, they are then unresponsive. You can then, obviously, if you're on your own, then you shout for help. If you've got people around you, then hopefully that help will already be there. You then have to open their airway, especially if they're lying on their back, because as the body relaxes, then the tongue can relax against the back of the airway, and they will, in inverted commas, swallow their tongue. Basically, the tongue will just fall back and it will block the airway. It doesn't physically go down their throat. And very simple thing to remove the tongue from the airway, which we'll show you in a second. You then have to assess their breathing. This is the most important step. So if you haven't done first aid for a while, then you might have remembered a circulation check, and we used to check pulses. We don't do that anymore. It's difficult enough to feel your own pulse when you know you're alive, let alone when you're panicking, you're sweaty, they're sweaty, and trying to feel their pulse. You've got no chance. So we only do a breathing check now as a lay first aider. Okay, that's what we do. So we open their airway so that it clears the tongue away from the back of the throat, and then we check their breathing. Okay, so this is what we do. So just going to move me out of the way there. So the way to open the airway, and if you have a look here, if you're lying on your back, tongue relaxing against the back of your throat, then the tongue will block your airway. So even if you could breathe, even if your diaphragm is trying to pull air into your lungs, you won't be able to get it in there because the tongue is blocking the airway. Okay, so you have to tilt the head back and lift the chin, and then that will clear the blockage, that will clear the tongue away from the airway so that then that person can breathe. And if they are breathing and their diaphragm is pulling the air in, you will be able to see immediately that they're breathing or not, okay, or whether their breathing is normal. So 2 fingers underneath the chin, hand on the head, and then you just tip the head back to open up that airway when they're lying on their back. And that, if you don't remember anything from today and you just remember that, then that will be a winner, okay, because that's really important. So that is how you open the airway and then check for breathing. Then you've got some decisions to make. So I'm just going to skip forward a sec. Decisions. So if we have a look down here, so we've checked for danger, we've checked their response. So are they alert? No. Are they responding to my voice? No. Are they responding to pain? No. Twist of the ear is not working, so they are unconscious. I then need to shout for help. Hopefully help is near me. I then open their airway and I check for breathing. Now, this is slightly different in COVID times because of, obviously, it's a respiratory virus. At the moment, we don't do our normal breathing checks because we don't really want to be in that close proximity to someone else's expired. So you could still hold the head, tilt the head back and lift the chin, and you would just look for obvious signs of breathing with the chest rising and falling, using the back of your hand over their mouth to see if you can feel the breath on the back of your hand. But usually you would have your ear right close to their mouth, you would look down their chest, and you would look for the rise and fall of the chest. Okay, now really important, we check for 10 seconds to see if their breathing is normal. Yeah, so that's what was said before. It has to be normal, rhythmical breathing. So let me just show you what not normal breathing is, because it sounds a bit weird, and you think it's obvious what breathing is, but actually it's not. So let's have a look at this. If you turn the sound up on this one, so we have a casualty falling to the floor, having a seizure. So you check for danger, you check for response, you say, hello, can you hear me? Can you open your eyes? No response. Twist their ear, no response. There's no response to anything. So we open their airway and then we check for breathing. Now listen to this. So on first thoughts, you might think that person's breathing, but actually that's called agonal breathing, and that isn't normal breathing. So don't be confused with agonal breathing and normal breathing. So rhythmical breathing, normal breathing needs to be in and out, nice and steady. If it looks like that, that is not normal, and you would do CPR on that person. that is on YouTube. If you want to have a look, it's called agonal breathing. Okay, so you can have a look at that video. All of the stuff today is on YouTube. Okay, so you can have a look at anything on there. So that's how you spell it. That's agonal breathing. Okay, the breathing needs to be normal, and that was not normal. So you need to do CPR on that person. Okay, so we've checked for breathing. We checked for 10 seconds. If it's obvious that they're breathing straight away, you don't need to use the full 10 seconds. If it's not obvious, you use that whole 10 seconds to make your decision. Okay, it's really important. So if you decide that they're not breathing normally, then we need to get an ambulance straight away. And depending on the setup of where you work and what kind of situation you're in, you might have a defib with you, like the guys that ran on the pitch on Saturday. But obviously in normal circumstances, you wouldn't just be carrying an AED around. So immediately, you don't do anything, you call an ambulance straight away. And then if someone is around you as well, then you can ask them to go and get a defib. If you are completely on your own and you don't have anyone around, but you know that there's a defib somewhere, you would call an ambulance and get that defib before you start doing anything. Okay, because it's so important to get that defib on them as quickly as possible. You don't want to delay. So you don't start doing chest compressions, you don't start doing breathing unless someone else is gone. If you're on your own, so if you're on your own, you don't start any of that. You get the defib first, and then you get the defib on, and then you get going. Okay, if other people are around you, you use those people, get them to get the defib, and you start CPR. As long as that defib and the ambulance is on their way, that's the key bit. Okay, so it's really important. We then start doing chest compressions and what we call rescue breaths. Okay, so we're going to have a look at that in a sec. We do them a ratio of 30 to 2. So 30 compressions of pushing on the chest to 2 breaths. But at the moment, because of COVID, the Resuscitation Council guidelines are that we don't do mouth to mouth. We do compression only CPR. And at such a stage when the COVID risk is reduced, we will go back to normal resuscitation guidelines. But for the layperson, it's compression only CPR at the moment. Okay, so we would only do the chest pumping. So let me just show you this little video. So again, this is all available online. So this is one that's available from the St. John's ambulance. And this is doing CPR on an adult.
If you've come across someone not breathing and you have a friend with you, get them to call for an ambulance stating that the person is not breathing. If you're by yourself, call for the ambulance before you start CPR.
Okay, so that's just what I was saying there. Yeah, it's really important that you get that ambulance there and the AED, if there is one near, as quickly as possible. If you do CPR, remember we said that if you just do that and that's all you do, the chances of survival are really low. So we have to get that AED on them as soon as we can, or the ambulance on the way.
To do CPR, take one hand and place it center of the chest. We're going to interlock, lean right over. We're going to go down 5 to 6 centimeters at a rate of 100 to 120 beats per minute to the rhythm of staying alive.
Now, I think with if you've never done this before, the best thing to do is let me just switch my screens a sec, just so you can see me. So top of your sternum is just here. Okay, so you've got these two muscles here that kind of converge on the front of the top part of the sternum bone, your breastbone. So that's the top part of the sternum. And if you feel your ribs at the bottom and come up to the ribs, just stand up a bit. Oh, there we go. So just there. So between there and there, that's where you need to push. And you use that part of your hand. Yeah, you don't want flat hand. You want to lift the hand up. So it's that part that's contacting the sternum, and it needs to be right in the center of the chest. You've got to lock your arms out, so dead straight. Yeah, lock them out. If you bend your elbows when you're doing this, and you've got to do 100 to 120 a minute, yeah, that is a lot. That is a lot of compressions to do in a minute. And if you're using your arms to do it, your arm muscles will fatigue really quickly. And so you need to use your body and keep your arms really straight. So just go back to that video a second. Let's go back to Winston. Here we go.
Interlock, lean right over. We're going to go down 5 to 6 centimeters.
His arms are dead straight.
at a
He's
rate
using his
of
body, so he's
100
rocking
to
from his hips.
120 beats per minute to the rhythm of Staying Alive. So that's chest compressions.
So the reason why we do that, we need to push down 5 to 6 centimeters. Okay, so that's a good few inches. Yeah, if you think about the size of your heart is roughly the size of your fist. So what you have to do is push down on that rib cage, on that sternum bone, so that it compresses the heart, squishes the blood out, which is the job that the heart would normally do, so that the blood is then ejected out of those blood vessels around the body and up to the brain. So basically what we're doing is we're doing the beating of the heart instead of the heart, because the heart can't do it. Yeah, so the electrical wiring is all messed up. The heart can't beat properly, so we're pushing that blood out and doing its job for it. Okay, that's really key.
To breathe, we're going to open the airway, close the nose shut, make a C with our mouths, give 2 full inflations, 1 breath per second.
Okay, so there, I don't know whether you heard Winston there, but you pinch the nose. You've got to have the head tilted back, because if it's flat, it's going to block the airway, so the tongue will block the airway. So you lift that chin, seal all the way around the mouth, and then blow in, and you'll see the chest rise and fall. And you do it nice and gently, rise up for a second, and then back down again. And we usually do 2 rescue breaths, but as I said, at the moment, the guidance is that you don't have to do mouth to mouth. You can do just compression only CPR. Okay, so if you didn't have a defib, that is what you would do. Okay, now when you've got a defib there, you don't delay putting it on. Okay, so let's do a scenario where, let's say I'm on my own and then I see someone collapse on the floor. So I check for danger, check their response, shout for help. And when I shout for help, someone goes, "Oh yeah, how can I help?" So you go, "Hold on there a sec, I just need to check their breathing." So we open their airway, we check their breathing. We look, listen, feel for 10 seconds. There's no breathing. So I would say to that person, go and call me an ambulance, tell them where I am, and go and get me a defib, or if there is a defib nearby, and make sure you come back and tell me how long everything's going to be. And then so they're off, and then immediately I would then start doing CPR. As soon as that person then comes back with the defib, we would then prepare the person ready to put the defib on. And if me doing CPR is getting in the way of that preparation of putting the AED on, then I stop what I'm doing, because getting the AED on is the most important thing. Okay, so that's really key, and one of the differences when you've got an AED. So let's have a look at a defib then. So this is the percentage of success, and this is the time. So the chances of success of recovery from a cardiac arrest, they diminish by 7 to 10% each minute that you don't have a defib on. So if you have a look here, if you get the defib on between 0 and 1 minutes, then they have an over 90% chance of survival. Every single minute that goes by that you don't get that defib on and someone's faffing around, or you don't do something, you forget to go and get it, or whatever it is, then that person's chances of survival just drop and drop. So if you don't have a defib nearby and you live in the middle of nowhere, and there's sports that are being played and there's a potential risk for cardiac arrest, if your nearest ambulance service takes sort of 10-15 minutes to get to you, then the chances of survival are really low. Okay, that should be part of your first aid risk assessment, and really you should be looking at getting a defib. And there's loads of stuff that the British Heart Foundation do, along with the Red Cross and St John's, to try and get defibs into facilities like that, and especially sporting facilities. Okay, really important that you get that defib on quick. And the report from Saturday was that he only needed 1 shock, and thankfully that brought him back around. I know the Fabrice Mwamba case quite well, and he was being shocked and CPR being done on him for over an hour. Okay, so he was really lucky to survive, and it was because of the medical team that was around him, and they were able to get him to hospital, having kept him alive for that long. So, professional footballers are in a real lucky situation. That they've got a much higher chance of survival. So if you're going to get a defib, this is the stuff you need. So you need some clothes cutting scissors. Everything comes off, okay? With females, bra comes off, top comes off. You just cut through the middle of the top. You need to expose the whole chest, okay? You also may need to shave people because of where the pads go. And if the pads aren't sticking to the skin, if they're floating on the hair, then it won't be a good enough contact for you to be able to use the defib. It will send an error message to the defib like it's not connected. Okay, so you have to shave the skin. You might need a towel as well and a pocket mask for doing your mouth to mouth. So this is the usual kind of kit that you would have with your defib. Okay, so that should be with the defib when you get it. And then this is the defib that I've got. It's got 2 buttons on it. Nowadays, there's only 1 on certain models, and that's because in panic situations, sometimes people panic and they press the off button instead of the shock button. Okay, but really be aware of that. Okay, on quite a few models, you don't have a choice now. There is no on-off button. It's as soon as you open it, then it turns on, and then there's only the shock button as an option. Okay, so just be aware of that. There are sometimes 2 buttons. One is clearly labeled shock, and when a shock is administered or it's needed to be administered, this button will start to flash and it will tell you what to do. Just on the top right hand corner of my machine, so this is my machine, there is a little flashing light there, and that is something that we check daily in the clinic to make sure that the battery is still alive. So the battery goes in the side here, and they usually last for about 5 years. Okay, so the battery life is really good. That little black bit there is where the pads will attach, and then the pads are then stored around the back. We have adult pads because we don't deal with any pediatrics, but if you're dealing with kids, you might need some pediatric pads as well. Okay, so just some of the things you might need. This is where you place them, and it's really obvious when you have a look at the pads as to where they go. So one pad goes on the upper right shoulder, so around this area here. So this is why you might need to shave this area here. And then the other pad goes just along the kind of side and bottom of your rib cage on this side here. Okay, if it's not in that exact placement, it doesn't matter. As long as it's in that rough position, then you'll be fine. And there are diagrams on the pads to show you exactly where to put them. So you don't need to worry about remembering. Okay, so this is just a bit about setup. So AED placement and setting up. Again, this is on the St. John's website. Now, imagine I'm doing my CPR. Okay, and my person who I went to go and get help has brought an AED. I carry on doing my CPR whilst they set up the AED. So they would cut through the clothing. And again, if I'm getting in the way, then I stop so that they can cut through the clothing and crack on. But if I'm not getting in the way, then I carry on doing my CPR. Okay, so we cut through the clothing, expose the chest, and the defib, which is here, always place that near the head. So it's really close to where you're working, so that you don't need to move anything. Okay, so the defib goes by the head and you can see everything that's going on. So imagine this person's doing CPR, so they're cracking on, and then this person is bringing the defib. Now, if your helper hasn't got a clue how to use a defib, but you do, stop doing CPR, put the defib on. Okay, so make sure you get that defib on as quick as you can. I don't know how many times I can say that in 40 minutes. Okay, let's have a look at the St. John's video for you. So this is how to use a defib. Here we go.
AED is short for Automated External Defibrillator. It's a life-saving device that gives a heart an electric shock when someone's heart has stopped in cardiac arrest. You can use an AED on adults and children over 1 year old. Using an AED in the crucial minutes before an ambulance has arrived increases someone's chances of survival. Anyone can use an AED. You don't need to be worried about getting it wrong because the machine analyzes the casualty's heart rhythm and then uses visual or voice prompts to guide you through each step.
So that's really important there, what Winston just said. So you can't go wrong with an AED. I mentioned that right back at the beginning. So when you place the pads on, what the pads will do is it will analyze the heart rhythm, and it will pick up, because of the electrodes on the pads, whether that heart is in VF. Okay, so remember that jelly-like shaking from before? So if it's beating normally, it will pick that up, it will identify that, and it won't shock because the heart is beating normally. If the heart's in VF, then it will shock the heart to get it beating back on that rhythm again. So that is why it's called a defibrillator, because you're in fibrillation, ventricular fibrillation, and you are defibbing the heart. Okay, so you're defibrillating it to get it back onto a normal beat again. I've just had a really good question there. So if we aren't doing the breaths, do we do continuous chest compressions? Yes. So you do 100 to 120 a minute and you just crack on, you carry on.
Make sure that someone has called for an ambulance. If you don't have an AED available immediately, start CPR until someone brings the AED for you. Before you can use an AED, you may have to cut away clothing, wipe away any sweat. As soon as the AED has arrived, switch it on. All will give you verbal commands, some may give you visual commands.
Apply pads to patient's bare chest.
Okay, so just pause that there. Now, this AED, I think, is a Lairdale AED, and as soon as you turn it on, it tells you what to do. So it's telling you there to apply the pads to the patient's bare chest. So you get the pads out. Now, just a little tip here. Now, these pads are really super sticky and they've got a plastic backing on. So when you take the plastic backing off, do one at a time, because if you do both and then you kind of all fingers and thumbs and then you drop one on the floor, it's going to stick to the floor. So take one off, place that on, make sure you get it in the right place, and then do the next one. Okay, so just take your time.
Place one pad on the upper right-hand side of the casualty's bare chest.
So you can see there on the picture, it shows you where each pad goes. Okay, so you can't go wrong.
Place the second pad just below the casualty's armpit. Next, we're going to plug the connector in.
Plug in pads connector next to flashing light. Analyzing heart.
Now, quite often you don't need to plug the pads in, they're already plugged in. The reason why we have to do that is because that's a training model, but usually on the real models, you don't need to plug them in. As soon as you've applied the pads, then it will be able to analyze the heart. Now, one of the key things that you've got to do when it is analyzing is make sure that you're not touching the patient, because it will pick up your heartbeat. Okay, and obviously it will think that the person's alive and it may not shock them. So that's really important. Make sure when it's analyzing, it will tell you to stay away from the patient and you make sure that no one is touching them.
Rhythm. Do not touch the patient.
Stand clear, everyone.
Shock advised. Charging. Stay clear of patient.
Stand clear.
Deliver shock now. Shock delivered. Paused. If needed, begin CPR.
Next, we're going to check on the casualty's breathing, and if not breathing, we will commence CPR.
So after that shock is delivered, that first one, it will then say to, if the person's breathing normally again, and remember the agonal breathing from before, so it needs to be normal rhythmical breathing. And if they are, then we can put them into recovery position. If they're not breathing normally, we then need to do CPR. And we push the chest like it was shown in the last video. We do the rescue breaths when it's normal time, or we just do chest compressions only for now. The guidelines are if you're unable or unwilling to do mouth to mouth, then you don't have to. Even in normal times, you can do chest compressions only. Okay, so 100 to 120 a minute. And what you would do is you'll do that for 2 minutes. And the defib will count. So the defib will be set for 2 minutes. And after that 2 minutes time, it will then reanalyze the heart. So as soon as it tells you to stop CPR and it will give you those commands, you take your hands off, you let it reanalyze the heart, and then it will tell you whether a shock is needed or not. And then it will say, check the breathing again. And if they're not breathing, you carry on doing CPR. And that is it. And you wait for the ambulance to come. Okay. After the ambulance has arrived, you keep on going until the paramedics tell you to stop. All right. The only other reasons you would stop is if you get too exhausted, the paramedics tell you, or that person regains normal breathing again, and then we put them into recovery. But what we'd have to also do if they do start breathing normally again is make sure we keep an eye on them, because they may need resuscitating again. So you would constantly check their breathing, and then if they're not breathing, we get them back on their back and then we start CPR again. Okay, so it's really important that we can monitor them all the way through. Just going to go on to, I think that might be the last one. Yeah, that was it. So hopefully that's helped. And if you've never even seen an AED before, you've never known what to do, you weren't really sure about what buttons to press or anything like that, or where to place the pads, just go for it. Okay, they are in a lot of public spaces, and if you see someone who drops to the floor and they stop breathing, get an AED on them as soon as you can. The ambulance and AED, really key. I hope you found that useful, and this is probably one of the only courses I teach where I say I hope you never have to use it. A lot of the courses I teach, I go, you can use this on Monday morning, it'll be great with your patients, but this is the one where I don't want you ever to have to use it. The law of averages are that if we do have to use it, it will be probably on a member of our own family or our friends. Okay, so it's really key that you understand these things, even just the basics, and just have a go. Okay, you're very welcome. Thank you, guys. Yeah, like I said, you can watch this back on our Facebook page, and you can share it as well if you want to afterwards. I'm quite happy for it to be shared. All of the resources today are on YouTube, so you can search for any of the St. John stuff, any of the British Heart Foundation stuff. It's all on there. Okay, cool. Take care, guys. Have a good week, and I'll see you soon. Thanks.